mentioned I'm 70, and let's say because of your company 5 years from now, what's going to change in my world or somebody like me? What's going to be the one thing because of what you're doing that wouldn't have been true back in 2024 if we're talking about 2029?
Thank you, Dr. Klasko, and hi, everybody. Just to give a quick background on Kemtai, so we are in the musculoskeletal space mostly. We're a computer vision platform that gives real-time feedback and corrective guidance for physical therapy. And when I think about what the impact will be over the years, well, I think it's going to be in the MSK space. Well, it's the biggest driver of costs in the US healthcare system, more than cancer, more than diabetes. It's known that physical therapy and rehab can very effectively improve outcomes and reduce costs, but it's not actually happening in practice. Those costs are continuing to rise, and that disconnect is where Kemtai is trying to play by making physical therapy more accessible and more scalable. We are trying to make sure that the benefits that we know physical therapy can drive are actually realized. And in terms of the longevity category and why that's relevant, well, physical therapy is particularly inaccessible for older adults, given transportation challenges, wait times, et cetera. And so by making all of that more accessible for older adults and the broader population, we hope that the benefits of physical therapy that we know exist actually come to fruition rather than the rising costs and poor outcomes that we continue to see today in that space.
So my three-part question is, what are you doing within your very innovative spaces to put trust in, and trust being as important as technology? Who's going to pay for what you're doing, and where do those benefits accrue, and how can you make sure that the new technologies aren't just helping Steve Klasko in Miami, but helping Mrs. Jones in North Philadelphia that might not have access to or a Ring and Apple Watch and the technologies that you're doing?
No problem. So I'll start with the equity piece. We have, in the design of our product and offering, been very deliberate in keeping equity in mind from both a scalability and accessibility perspective. So Kemtai runs on any device with a camera, so a phone, a tablet, a laptop. These are devices that most people have, and it allows us to reach those populations that traditionally have been unable to attain, strong quality care in the rehab space. And we're seeing, that this allows those populations to have access to it. And then in terms of who's paying for it, well, a couple different segments of types of organizations that are paying for it. One is providers, right? So we're helping to make their care more efficient. They can treat more patients with the same level of clinical staff, and level of clinical staff is obviously a big issue today with shortages. Then you also have digital platforms that are serving the market with their own specific solutions, and they need a way of bringing it to their populations around the country or around the world. And then lastly, payers, right? These are organizations that are shouldering the vast majority of the huge musculoskeletal care costs in the United States and in other countries as well. And so they're looking for opportunities to reduce those costs and improve outcomes for their patients as well.
It's hit me coming over from the traditional healthcare ecosystem to General Catalyst that the humans that are involved in your team are incredibly important. And all of you have curated, because it's all your money, who you have on your team. So in 3 to 5 words, if you could just say, what defines the culture of your team that really makes it unique, that will get somebody to want to invest in you?
Experienced and extremely collaborative and flexible.